Hi there, it is Dr. Fern here, the creator of the online program for dentist women, Practice Your Passion. Running late, I've been there. There were times when I first graduated and I was seeing 20 patients a day from 2 rooms, running like a mofo from back to forth, and I didn't even know who I was seeing. I didn't even know their name after a while. I was just like a mad woman. Or there would be times when suddenly something happens and, I'm taking out surgical wisdom teeth and bang, what am I going to do? I'm running late. I can see the clock ticking. I can hear the next patients come in. Like, what do we do? Because I have to say, us dentist women in general, we're perfectionists, and really we run late because we're trying to do the best that we can possibly do. We're trying to be the perfect dentist. And so I'm going to pull it back and say, hey, it is not your fault, but there are some things that you can put into play that will help you not run late. Okay, so are you ready for this? Let's start. The first thing, if you are just getting your bearings, say you're in a new clinic, you're just getting your bearings, what I did is I always add more time and I insist upon it. If you're an employee working for someone else, insist upon it. Insist upon more time. Insist upon 15 minutes extra or 30 minutes extra, whatever it is. Because for me, it is not worth shortcutting your work, getting into the habit of doing things quickly but half done or not to your perfection standard, as we should as dentists. That is not run. So spend more time, get better with your procedure, make sure you do it accurately, and then you can start to speed it up. So that is the first way that you want to do it. The second way is if you are running late, because running late not only has ramifications for yourself, but it also has huge ramifications for your team. Like, they get stressed out, especially if they have NARCI patients waiting for you, or they are knowing that they're going to miss out on their lunch break, whatever it is. The second thing I would always do is make sure if I'm running late, we can be in a fluster. We're not thinking properly. So I just step out of the room if I need to. Like if I'm in the middle of a wisdom tooth extraction and everything's going haywire, and if I just keep going, I will not think properly. And I will just be pushing my luxator in and doing the same movement over and over again. And that's insanity, right? So what you want to do is recollect and switch state. So go into another room, shake it out, and then take some deep breaths, take a drink of water and come back, and you will see that suddenly that change has created a different atmosphere for you to think from, as opposed to the fight, flight, stress state. And then you can quickly communicate. So really clear communication to your team. Over then under is always best. Like, the worst thing you want to do is find that you call patient 15 minutes for them to come later, and then you take another half an hour later. That is going to be still a very disgruntled patient. So really important to do that. Communicate with your team. Overdo it than underdo it in terms of their time. Okay. And then thirdly, really for you, it's just up to yourself to familiarize, to keep training, honing in your skills, doing that. Take responsibility for yourself as a clinician. Always aim for growth, for a growth mindset. Like, every time you run late, like I used to come back home and I think, okay, what did I learn from that? What could I have done better? And then summarize it. And that is how you grow, and that is how you don't make the same mistakes. But from these things that happen, they're stressful, but you can always take a growth mindset and turn it around and think, how did I grow? What did I learn from this? What can I do next time to not run late? So I hope that has helped you. And the main important thing is really communicate with your patients, communicate and make sure that they are aware of everything. And, just don't pretend that there's an elephant in the room when your next patient comes in. Apologize profusely and say to them, I'm so sorry this has happened. This is not the norm. And I really want to make sure that that patient had the care that they had, and would do exactly the same for you as well. So just stress that, show the patient that you care about them, and explain it to the patient who you ran late for, and the second one as well. It's all communication. Everything, 90% of your problems will be eliminated by really good communication. So that is my dose of Dr. Fern for you today. If you like what you hear, please share this with someone who you think will benefit, who may benefit. And remember, the most important thing for you is to keep laughing out loud. It is the second best thing that you can do with your mouth.